For some viewers and listeners, today's episode could be life-changing because a common but under-recognised problem can wreak havoc with our skin, gut and health in general. It's called histamine intolerance, and I'm not just talking about hay fever.
It's thought to be about 20% of the population.
I have struggled with terrible PMDD symptoms, bedridden, menstrual cramps.
I bet there's quite a few people out there who are going, oh my goodness, this could be me. And I completely get what poor people feel who are pushed from pillar to post and told that it's all in their heads.
Now, histamine plays an important role in our immune system, but when your body releases too much of it, it creates a buildup. And as you'll hear, that in turn can create a wide range of symptoms, which can be really debilitating. My guest today, Dr. Tina Pearce, built her expertise in histamine intolerance the hard way, and she will share the heartbreaking story of how her daughter suffered terribly before they were able to finally identify the root of the problem and start to treat it. Having begun her career as a general practitioner, Dr. Pearce later specialised in menopause and remains the clinical lead at the Menopause Consultancy. But having built significant expertise in treating histamine issues as well as long COVID, she now practices integrative medicine, where she works with patients to find the underlying cause of conditions rather than simply treating symptoms. I'm Clare Johnston, a journalist exploring how to age well, and I do that on YouTube, podcast platforms, and on my website, honest.scot. And what my guest today shares with us is both moving and could be the vital missing piece in the puzzle for those who may be suffering, unaware of what's driving their symptoms. Dr. Tina Pearce offers valuable insights and opinions in this episode, but the content is not intended to replace personalised medical advice. Well, Dr. Pearce, thank you so much for your time today. I'm really looking forward to this one.
It's my pleasure, Claire. Thank you for inviting me.
Well, I think the whole idea of histamine intolerance is going to be new to quite a lot of people. And I suspect a good few might leave this conversation wondering whether they might actually be affected. It's something you must come across a lot. People who suddenly the penny drops. This could be me.
It happens all the time because actually it's incredibly common in the population. It's thought to be about 20% of the population. So that's actually a lot of us. And it's 80% of the sufferers are female. So that's more than 20% of the... I'm talking about MCAS now, actually. Histamine intolerance is almost the same, but slightly less.
And MCAS, I mean, we can come on to this. We'll break down what it is, but just so that people understand that, that's to do with mast cells, is it? What's MCAS?
Yes, so Mast Cell Activation Syndrome is MCAS. This is an inherited condition. 80% are female. So therefore, it's more than 20% of the female population. And 80% will have Ehlers-Danlos syndrome, hypermobility of their joints.
Okay.
To a certain degree, and 30% will have interstitial cystitis. So I bet there's quite a few people out there who are going, oh my goodness, this could be me.
Yeah,
Once
already.
They hear that. Already, yeah, absolutely. So that's mast cell, and the mast cells are overreactive. They overreact to the environment that the person is in, and then they cause hyperinflammation, basically, in various different systems that cause symptoms.
Got it. Well, this came onto my radar recently because just before Christmas, I had a virus. I think it was probably COVID. It wasn't terribly serious, but I had a lot of gut problems, I had a lot of headaches, and they just carried on. And I had all the tests, and my doctor said, can't find anything wrong. But he gave me something called famotidine. I think US viewers and listeners will know that as Pepcid. And that just completely changed the whole thing. The diarrhea stopped almost overnight, the headaches stopped, and that got me looking into histamine intolerance, because I think that famotidine blocks the effects of histamine in the gut. So that started me looking at what's histamine? Why has this been so effective for me? And that's what we're going to be discussing today, obviously. But you have built a lot of expertise in this area because of a personal experience within your own family where your daughter, you discovered this was an issue that was really badly affecting her. Can you just talk us through how it first came across your radar?
Yeah, so when she was a very small baby, 3 months old, she started to develop eczema. And my other two children didn't have anything like that. And she was, she became quite unwell with it. And we were trying various different remedies, etc. for her. And homeopathy actually worked brilliantly at various times. And then it would lose its efficacy. And anyway. So she'd had eczema. We were hoping that by the time she was in sort of going through the starting to menstruate, etc., that actually it would stop. But it didn't. And also when she was little, she had a lot of gut issues. She always looked a bit bloaty and very pale and pasty. And my other children looked so healthy in comparison. And she never complained. She was the most amazing little girl and is now the most amazing mother. And she just... she just suffered in silence, really, and she thought it was boring to talk about it, so she didn't tell us when she was in discomfort. And then when she was 16, she moved to the college for the sixth form, and she caught swine flu. And when she had swine flu, she became really very unwell, and she had a migraine headache for 6 weeks. It was awful. And she became very bloated. Her eczema became very severe. And she just looked really, really unwell. And we weren't quite sure what was going on. We took her to the GP. There was nothing that they could offer us. But we did have her thyroid function tests done, and it showed that she was hypothyroid. But the GP didn't pick up on it and didn't treat her. And they just kept reporting the results as normal to us, which we later found out wasn't the case, which was very frustrating. So I think she had 2 years of hypothyroidism, which was untreated. So she wasn't very well. And from then on, she sort of became very chronically fatigued. And she would have IBS type symptoms. And so it wasn't great. And then she became a student nurse. And when she was a student nurse, when she was about 23, I think, in 2016, she decided she was so fed up of feeling chronically tired and having to sleep in the afternoons and so on, that she would go on a health kick. And this health kick consisted of doing lots of exercise every day and also drinking superfoods in a sort of bullet. She would put them together. So it was all the green stuff, avocados, tomatoes, spinach, all the things that are really high in histamine. So bless her heart, she was trying to get as fit as she could, and she was using these healthy foods that everyone tells you and that are healthy as long as you don't have a histamine issue. And she became progressively more and more poisoned by her own histamine and reaction to these foods, which over a 4-week period, she became so ill. It was unbelievable. She was suddenly feeling very dizzy. She had POTS, basically. So she would suddenly feel incredibly dizzy, like she was going to faint. And she'd have to put her head between her legs, between her knees. She would suddenly feel sick and have, especially in the middle of the night, at 3 o'clock in the morning when you get a histamine dump, she'd wake up and run to the bathroom thinking she's going to be sick. And sometimes she was and sometimes she wasn't. She had terrible insomnia. For 7 days and 7 nights, she couldn't sleep a wink, even though she was exhausted. She had a headache that lasted for 4 weeks. She had her eczema just getting worse and worse and worse and worse and worse. It was really appalling. And she came home because she was living just not very far away, actually, thank goodness, about a 15-minute drive. But she came home one day and burst into tears, which is just so unlike her. And she said, I feel so ill. I don't know what's going on with me. And she was really sort of, scared. And I said, well, look, honey, we sort of went over a few things. And I said, let's look at your thyroid, because you haven't had your thyroid checked recently. And we got to get that right. So we sort of honed in on that. Then she went away and she got worse because she carried on with her superfoods. And she became so bloated and swollen, she could hardly open her eyes. And her mouth became all excoriated. So she couldn't really eat very easily. And she rang me up in the middle of the afternoon on a Saturday, and I was doing a big dinner party for some friends, and she rang and she was crying and she said, I feel so unwell, I don't know what's going on. I said, well, I'm going to come and get you. So sorry.
Oh, I can just imagine when your child is ill like that and you don't know what's happening.
It was very scary. And I completely get what poor people feel who are pushed from pillar to post and told that it's all in their heads and that there is nothing wrong with them. It just breaks my heart.
I know, I can imagine, because so many people are going to be connecting the dots through this, which is fantastic. But if you don't know, it's so scary.
Well, and it breaks my heart for everyone out there who has been through this, because it's very, very scary. And I brought her home and she looked extraordinary. She had dermatographism, which is where you could literally, she was so red in the face, you could write on her forehead and it would stay there for 20 minutes. Her eczema was so bad that if she moved her neck, her skin would split. Her arms were bloated and swollen like I'd never seen them before. And what she had was massive inflammation in all her tissues. And literally the food had been poisoning her. The high histamine food had been just poisoning her system. And her mast cells had been releasing more and more and more of the cytokines, these very powerful chemicals that are released by the mast cells in order to protect and defend the body. But actually, when it goes into overdrive, it's just awful. It poisons the body. Anyway, we sat her down. We finally worked out that we thought it was some kind of histamine reaction. And I had remembered that 9 years before, a friend had said, do you think Jessie could have histamine issues? And when I looked on the internet then, which would have been, in 2007, there was nothing. There was just nothing about it. I couldn't find any information about histamine intolerance. But I'd sort of just popped it away to the back of my head. And when we thought this is histamine, and I started looking it up again in 2016. There was more information, which was incredibly helpful. Not how to treat it and stuff, but a little bit of information, which was enough to make me think I'm barking up the right tree here. So we took her to see 6 different doctors. 2 professors. One was a professor of immunology and allergies who specialised in eczema, and another one was a professor of dermatology. And neither of them had heard of histamine intolerance, and it was a complete waste of time and money seeing them. And in fact, the immunologist was appalling. He said, in front of Jessie, he said, I think she's got a brain tumour. How he came to that conclusion, just because she'd had a headache for 4 weeks, but he didn't look at all of the other symptoms and think about what he could see in front of him, which was this bloated, allergic, kind of inflamed girl. And it was just unbelievable that he said that in front of her. It was just incredible. Absolutely terrifying. Anyway, luckily, you know how parents you can look at your child and you can send a message through your eyes. And as soon as he said that, I looked at her and
ignore
I hadn't it. Well, actually, what I communicated was
something a lot stronger.
It was a bit stronger. And anyway, so we left there, 860 pounds poorer and very disappointed. And upset, really, that we hadn't got anywhere. We were hoping that he would help us. But anyway, eventually I found this amazing doctor who's Professor Vic Kular. And Professor Vic Kular is a urogynecologist at St Mary's Paddington. And he... I got in touch with him through a mutual friend, another professor, and I explained to him all her symptoms. And I said to him, we were talking for about 45 minutes. He was so generous with his time. And I said, I think she has histamine intolerance. And he said, you are absolutely right. And I could, honestly, it was
I can feel the relief. Yeah.
It was like, thank God, because I kept thinking, I'm missing something more. I'm missing something super serious. She's going to die, you know. Anyway. So he was absolutely brilliant. And then he mentored us really into how to treat it, what to do, and how to improve things. So that's how we started our journey of healing and repair, really, and learning, learning. And of course, at that time I was a consultant in contraception and reproductive health. And so I was seeing a lot of women every week who would come of all ages, and they would be asking which contraceptives they could use safely and would suit them. And I would be taking a history, and I started diagnosing histamine issues in 3, 4, 5 people a week. And in fact, I could diagnose them when I called their name in the waiting room, because they had a pale sort of look. They had a look about them, I could just see that that's what they had. And it was fascinating. And it was very rewarding, because I could say to them, I think I know what some of these other symptoms are caused by. And they would burst into tears because they were so relieved. First of all, that somebody was interested in those symptoms. Secondly, that somebody had joined them all together and then had some kind of advice and, help for them, explanation. Because up until that point in time, sometimes for decades, they had been sort of gaslit by the medical profession, or given antidepressants, or told they're just over anxious or hypochondriac or something. And many of them had even stopped complaining about their health to their family and friends, because they thought, I'm just sounding like a hypochondriac and it's boring for them, so I won't even say anything, And these poor people.
It's unbelievable, isn't it? And why do you think it is that it is so under-recognised and underdiagnosed? Because I suspect I'm going to see a gastroenterologist soon, and I'm going to put my histamine theory to this person, and I don't know whether they're going to go, oh yes, I recognise that, or just...
You might be lucky, Claire, because things have changed a lot since 2016. So this was first put together as a syndrome, somebody linking all of the different systems and inflammation being the common theme between all of the systems. So whether it's bronchitis or sinusitis, or it's, IBS type symptoms with ulcerative colitis, or, all the inflammations, eczema, psoriasis, rosacea, all these inflamed conditions. And somebody pulled that together in the 80s. And it was given a name of histamine intolerance and mast cell activation in the 90s. And it was in 2007, so a long time had gone without it being sort of flagged up to people, to the medical profession in particular, and to the patients, very importantly, until 2007, when 3 case studies were published in the medical literature. So now the chances of all the doctors seeing these 3 case studies is very, very slim indeed. So most doctors didn't know anything about it, and they had never heard of it, and yet they are seeing it constantly in their clinics, in their GP practices, in their gastroenterology clinics, in their neurology clinics, in their headache clinics, or they're seeing it, dermatology, etc. But they weren't aware of it, so they couldn't join up the dots. And it is a little bit like a dot to dot. And once you start joining up the dots, you get a very clear picture of what's going on everywhere in the person, and then how to help them, which is the most important thing. And if you can understand what's going on, then you can start to make some improvements to their health.
Yeah, because without it, you are lost, because you're trying to follow sort of IBS-friendly diets. And, in my own case, when I'm talking about healthy aging all the time, I was really trying to, eat fiber and drink kefir and these kind of fermented foods. Absolutely. I could have always said that kefir was something that gave me stomach acid and I didn't respond well to. But I would keep ploughing on with these things because that's the right thing to do. Spinach in this, exactly what your daughter did. I did the same. Avocados. Could not get my head around why I was not getting any better and why my nose was running after I ate these things. So I think people listening and piecing it together, there are a wide range of symptoms, and we think about histamine in relation to hay fever and so on, but now this is factoring in the gut. What is the range of symptoms that someone with histamine intolerance could be experiencing?
Very often itchy skin. So itching is a very common feature. Hives. So if we talk skin for the moment, so it can present as itchy skin, particularly in the evenings, because our histamine levels go up naturally then. They maybe get it particularly when they go to bed at night in bed. Or it may be hives. It could be where their clothes press against their skin that they get hives. So around the waistband and things like that. It could express itself as eczema in the skin or psoriasis. or rosacea. And these are all skin manifestations. Flushing of the face after food, especially high histamine foods, and alcohol. And other drinks like tea and coffee and green tea are all very high in histamine, but they also, the alcohol, green tea and tea and coffee also are diamine oxidase inhibitors. So the diamine oxidase is the enzyme that breaks down the histamine in the gut to reduce the amount that's absorbed into your body, because the body recognizes, whilst a little bit of histamine is a good thing, too much is a bad thing. And we make this enzyme, diamine oxidase, to break down the histamine in our food. And if you're drinking tea and coffee and green tea or alcohol, it actually inhibits the diamine oxidase production. And so it's a double whammy. Not only is that beverage high in histamine, but it's also not going to be broken down. So you're constantly overfilling your bucket, your histamine bucket, and make it overflow. So that would be the skin. For the gut, it's inflammation in the gut. And inflammation in the gut can manifest as bloating, wind. It can cause distension, painful distension, not just distension. It can cause diarrhea. It can cause constipation. It can cause acid reflux or GERD, all very common. And then in the bladder, it can cause interstitial cystitis. Very often people who have this condition have a thickened wall of the bladder. And in that thickened wall, little colonies of bacteria will grow and live. And they're very difficult to clear with antibiotics. And they're also quite difficult to isolate which bacteria are there, because when they take samples of the urine, because they're intramural, they're in the wall, they don't really shed very much into the urine to show themselves. And so people can get irritable bladder kind of symptoms and discomfort, frequency and pain, but they keep being told you haven't got an infection, there's nothing growing. So that can be an issue. It can cause, what else? It can cause sinusitis. It can cause nasal drip. It can cause asthma, so-called asthma, which has a slightly different mechanism to asthma. Asthma is where the muscles constrict and relax and therefore tighten the airways, whereas MCAS, it's where the lining, which is full of mast cells, becomes inflamed. So the lining is inflamed and therefore the narrowing happens because of the inflammation rather than a muscular constriction. So slightly different mechanism, and therefore often it doesn't respond to inhalers and to conventional treatments for asthma because the mechanism is different. But it might respond very well to antihistamines and to montelukast, which is a drug that inhibits IL-6 excretion, interleukin 6. So that is prevented from being released from the mast cells, and that will reduce any sort of lung symptoms. So it can affect it can affect your nerves, and it can cause neurological issues. It can cause anxiety. It can cause panic attacks. As the histamine levels go high, your body produces adrenaline to try and bring it down, and that can make you feel very panicky all of a sudden.
You can feel that racing heart. Yeah.
Racing heart. It can, yes, it causes dysautonomia. It can cause palpitations, low blood pressure because it causes vasodilatation. So low blood pressure and palpitations are very common. It can also cause something called Kuoni's angina. Now that's Kuonis, and there's a website called Inoca, INOCA, which is specifically for people who have angina that is not being caused by narrowing of the coronary arteries. So there is no narrowing of the arteries, but these patients are experiencing angina because when the histamine goes really high, it causes constriction of the coronary arteries. So they spasm, and that causes anginal pain. Jessie used to get this from the age of 7.
Jeepers.
I
Wow.
remember her saying, "Mummy, I've got pain in my heart." And she'd sit still and it would last maybe 30 seconds or so and then pass. And it happened so often at one point where her histamine must have been super high. We took her to a pediatric cardiologist and he said, "No, so everything's fine," and reassured us, thank goodness. But it was definitely angina, and it was definitely happening even when she was sitting still, which sort of, angina normally happens to older people when they've got when they're doing some exercise or something and they've got a constriction in their coronary arteries causing the poor blood flow, and then the oxygenation of the heart muscle isn't as good. So this is a temporary constriction, caused a spasm really, caused by high histamine, and it's called Cohen's angina. So people can get that and think they're having a heart attack. There's and peripheral neuropathies, and sometimes people describe feeling like they're vibrating internally, and I think that's a neurological symptom.
It's a huge range of symptoms. How can people find out if this is what's affecting them?
Well, there's a consensus 2 statement it's worth looking at. It's called the Consensus 2 Statement, and it's by Dr. Lawrence Afrin and 40 other experts in this field. And they put together
I'll link
this
it below
statement.
just to let people to know. No, sorry to interrupt you there.
Lovely.
Yeah.
No, that's a good idea. It's important for people to read and understand that statement. It says that it's diagnosed predominantly clinically, and that's because the 2,000 different cytokines that can be released by the mast cells are very transient, and they are sometimes in very small quantities, but they're very strong. They have a very strong effect. So they don't need to be there in large quantities to create havoc in the body. And the body clears them out very quickly, but the effect of them can last much longer. So actually trying to identify and isolate these chemicals can be quite a challenge. And also they have to be in cold storage. So as soon as the blood sample or the urine is taken, it needs to be kept cold. It needs to be centrifuged in a cold centrifuge. Many labs just don't have this equipment. And there's only about 10 of the cytokines that can actually be identified at the moment easily in the laboratory. So it's not terribly productive, and it's actually counterproductive when people go for tests and they come back normal. It makes all the clinicians say you haven't got it. Whereas actually what they should be saying is, well, we didn't identify it this time because we didn't catch the little, we didn't catch them red-handed. and so, but unfortunately, clinicians, immunologists included, will say you haven't got it because it's negative. So in the statement, it says that it's multiple signs of inflammation in at least two different systems. So maybe that's IBS and chronic headaches, or IBS and hives. So it's in two different systems. And then plus or minus cystic formations, that's breast cysts or thyroid cysts or ovarian cysts or liver cysts, pancreatic cysts, etc., kidney cysts. These are caused and are very commonly associated with MCAS. So, or some hypertrophy of a tissue, and this is benign hypertrophy. But I've seen people with a sort of mass here in above their clavicle, and it's soft tissue, but it can't be explained away, and it's the mast cells. It's mast cells, so they can have these little gatherings of soft tissue. I've seen it at ankles, and I've seen it here, on the here in the midline, and here, but also plus or minus. So you've got the inflammation in at least two systems, plus or minus cysts or increase in tissue, plus or minus allergies, including anaphylactic reaction. So it's not always that people have anaphylactic reactions if they have this condition, and it's not always that they're allergic to things. But so it can be part of the picture, it may not be. And this broad clinical criteria is important, because if it's too rigid, so many people fall outside of the diagnosis, and then they fail to get the treatment and the help that they need. Whereas this actually is helpful. It's a helpful consensus 2 statement. And then the trial is really the diagnosis is by trial of treatment. And if you respond well to the treatment and the lifestyle changes, then it's a confirmation that you're barking up the right,
Yes.
the right tree, or the
Yes,
you're going, yeah,
exactly.
and you found the answer. So, I mean, the treatments are very much to do with lifestyle changes, because obviously we want to encourage people to have as natural an approach as possible. And that's important. However, pharmaceuticals are important and can be very helpful in this condition, but they're also very safe to take, and they're very sort of relatively cheap. So it's type 1 antihistamines, type 2 antihistamines.
And can I just clarify for people there, the type 1 is what we think of for what we use for hay fever.
That's
and
right.
The type 2 is more active in the gut, which is the
right.
famotidine, the pepsid. Yeah.
Absolutely, absolutely. So, usually we try people on type 1 and type 2. Not everybody needs to take both for relief, but some people find they do, or one is better than the other. And then we've also got some mast cell stabilizers, which can be very, very useful. Something like ketotifen, which actually calms the mast cells down. So whilst the type 1 and type 2 antihistamines block the receptors in the various tissues to stop the histamine that's being released affect those tissues and cause inflammation and reactions, the mast cell stabilizers are going to the root cause and are trying to calm the mast cells down and stopping them from releasing those cytokines in the first place that then cause the inflammation.
Can I ask then, well, just getting into the causes there, I mean, does everybody who has histamine intolerance have I'm going to call it mast cell disorder, or these overactive mast cells?
No. So some people who have mast cell activation have normal histamine metabolism and don't have histamine intolerance. They don't have low diamine oxidase production. But their system can be overwhelmed by the high levels of histamine that they're producing, even though their diamine oxidase levels were normal. They're being eaten up so quickly by the amount of histamine that's in the system that it becomes like a deficiency, and it looks like a deficiency, but it's not. And when you check them genetically, they are making the right amounts. They have all the good genes there to produce the DAO, the diamine oxidase. But in my experience, I would say probably 95% of people who have mast cell activation also have a bit of a problem with metabolizing histamine.
Yeah, that makes sense.
And so it's a bit of a double whammy. And when we did Jessie's diamine oxidase blood test, and that's quite a simple blood test to have done, and it's not reliant on temperature. So that is something that people can do very easily, and you can order one online. In the UK, there's various companies that do it online, and it's about 60 quid, so it's not too expensive. And when we did Jessie's, when she was very unwell, it said it was undetectable. She was using up her diamine oxidase so quickly, as fast as it was being produced, it was disappearing. So it said she had less than 2%. In other words, we couldn't detect it. It was so small. And after 6 months, we checked it again. And this was after modifying her diet, her taking type 1 and type 2 antihistamines, and sodium chromoglycate, which is another gut mast cell stabilizer, and various vitamins and minerals. It was 23.5. So it was much better, but it still wasn't normal, because normal is 30 to 200.
Okay.
And that's important for people to realize, because the lab, unfortunately, will say histamine intolerance is unlikely if it's more than 10. But I completely disagree, because I know that my daughter has histamine intolerance. We've done her genes. We know that she has that. And her level was 23.5. And but it's still less than 30, right? So it's not normal. So even on a good day, she can't make enough, really.
How is she now?
Oh,
With all
she's
these
great.
lifestyle changes.
She's great. She's got
Fantastic.
2 children. She's a fantastic mummy, and she's really, really well, thank you. And of course, pregnancy is a wonderful thing for MCAS and histamine intolerance generally, not in everybody, but generally, because the placenta will increase the diamine oxidase production to about 600 times normal. Because the body recognizes that it doesn't want to have an inflammatory response to any, the baby, blah, blah, blah. So it's fantastic. It makes literally 600 times more diamine oxidase when they're pregnant. So often when women who have this condition are pregnant, they can eat a wider range of healthy foods. They can get away with it more. Whereas, if they ate a tomato when they're not pregnant, it could really make them react, but they can enjoy tomatoes and strawberries and things like that when they're pregnant.
And I mean, can it be a sort of transient thing? Like I'm thinking perimenopause, when you get something like COVID and you just have a big reaction. Can you get a kind of temporary histamine intolerance or...
So my feeling about it and understanding of it is that there are 50 different mutations in the KIT genes which have been identified as can cause Mast Cell Activation Syndrome. People will have different combinations of those, or maybe only one of those. Now, if they have it very mildly, they will just have maybe one or two mutations, and they will be basically able to get away with a lot of stuff. But when there are certain triggers that keep pressing the mast cells into action, then they could get into difficulty. So these triggers could be something like mold. Living in a moldy house is really bad for everybody, especially if you have MCAS, because it will set off the mast cells and cause huge debilitating symptoms. It can invalid people, literally. So please make sure, everybody, you do not have any mold in your house anywhere. It needs to be sorted as soon as possible. So triggers are mold, infections, which is why people get ME, because they have MCAS, as far as I can see, and they get an infection and their mast cells don't really recover, and it sets up this inflammatory hamster wheel. So it just keeps going round and round and round, and they can't get off the hamster wheel. So they stay exhausted, they stay tired, they can't quite get their energy back, their concentration back, etc. So ME is definitely MCAS.
Which is something you do not hear a lot in the mainstream.
No, and I absolutely believe it. I would really recommend everybody watches two excellent lectures on YouTube. Okay. If you put in the Pentad, we could put the link as well at the bottom.
Yep.
They're called the Pentad lectures. They're by a fantastic pediatric cardiologist called Dr. Andrew Maxwell in Canada, and he really gets these lectures. It's brilliant. He puts the mast cell at the middle, and then he shows all these different conditions coming off and what the mast cells can cause. And I think it's a really good thing for people to see that, to start to really understand what's happening. So some people have it mildly and they get away with it most of their life, and then along comes the perimenopause. Now, when the perimenopause comes, what happens is estrogen levels fluctuate massively, even in the same day, even in the same hour. They can go high, they can go low, and histamine and estrogen are very connected. So when estrogen is high, it makes histamine release by the mast cells, and when it's low, it reduces the histamine release. So if you've got these fluctuations, you're going to have sudden surges of histamine as well as estrogen, and that will cause MCAS to start developing more and more, become more obvious. And so then poor women, they don't know what's what. Are they sleeping badly because of their night sweats and their low estrogen, or is it actually because their histamine has really got going and they're getting their 3 o'clock dump of histamine? And that can cause hot flushes too, so it's a confusing picture. And generally, to say the least.
I'm 52 years old and I've got all this going on. And, once you can start taking certain things out of your diet and using the antihistamines and so on, it makes a massive difference. But yeah, it's a very confused picture between the hormones and the histamine and what's driving what, and not being able to have that hormonal balance in your perimenopause years.
And often women go to a menopause specialist or to their GP, and they say, I've got all these symptoms. and they are diagnosed as being perimenopausal, quite appropriately. But the person isn't necessarily seeing the bigger picture and hearing and asking questions about, well, prior to this, did you have any IBS type symptoms? Did you have any, do you ever get any hives? Had you had any itchy skin? Do you cut labels out of your clothes? Do you have a very strong sense of smell? Do you dislike bright lights or loud noises? Because often those are good indications that this person has got hypersensitivity and have got MCAS in their history. And so these women are given HRT without any sort of nod to the MCAS histamine side of things. And of course, what happens when you're given estrogen? Your histamine goes up.
Yes.
So they're given estrogen, they find they feel worse, they go back and they're told, oh, you're not taking enough estrogen. We haven't given you enough. So now we're going to increase the dose and hopefully this will help you. And they go away and they get worse and they come back and the same thing happens again and again and again until they are just in a crazy position. They're really unwell from these high levels of estrogen and high levels of histamine. And until it's unpicked properly and somebody says, hang on a minute, let's come right down on the estrogen dose. Let's actually start again. Let's do some lifestyle changes. Look at having a low histamine diet, some vitamins and minerals to support your system, natural antihistamines like high dose vitamin C, etc., and quercetin, which is a mast cell stabilizer. Drinking dandelion tea a couple of mugs a day, is a mast cell stabilizer. It's got quercetin in it, as has nettle tea, etc. These are anti-inflammatory natural things that you can use, and that can help to reduce their histamine. And then very cautiously we add the HRT and we go up slowly, but we've got to get the histamine under control. Otherwise you just cannot catch up with what's going on. You cannot fix it. It's important that people, if they believe that they have a history that sounds suggestive of MCAS and histamine issues, that they seek a clinic that understands about these issues for HRT and the interactions.
Which will be easier said than done in some cases. I mean, obviously you have fantastic expertise, but just finding doctors that can make that connection. A lot of women, I think, are going to have to try and work this out for themselves in many cases.
I think they will. I mean, if they're in the UK, they can come and see my clinicians in my clinic, which is fantastic. And they are, au fait with all of this. But generally, having said that, when I first started doing podcasts and things in 2016 and talking about histamine issues, very, very few doctors knew anything about it. You didn't come across gastroenterologists or dermatologists or immunologists who knew anything. But since COVID came along, and long COVID, it is, in my opinion, MCAS, and it's just the infection has really sort of revealed it for people. And their mast cells have sort of, gone on steroids and are crazy and keeping them unwell. Since then, the mast cells have been discussed much more and they've made headlines. And so it's now unusual, I think. Well, it's more usual to occasionally come across somebody, a gastroenterologist or a specialist who does know about it and may even suggest it. So today I saw a patient this morning who said she saw a gastroenterologist who said, have you considered that you might have histamine intolerance and mast cell activation syndrome? And I was like, hallelujah, that's fantastic. And 5 years ago, that was never heard of. 3 years ago, that probably wasn't heard of much. So we are moving in the right direction.
I'm glad to hear it. I know that we're running low on time now. How overcomable is this? I mean, are people with histamine intolerance, is that basically, we're on antihistamines for the rest of our lives, or can it be completely overcome through lifestyle?
It can be. Very occasionally, some people have to be on them for long term. But usually what happens is as we stabilize the mast cells and calm things down, and as the person learns how to manage their condition, which trigger foods they really have to avoid, which situations they have to avoid, like, not having scented candles in the house or asking their friends not to.
I have scented candles all over my house.
Yeah, exactly. You see, and things like asking your best friend not to wear her perfume when you're going out together, because that could set you off big time. All of these things, when they've learnt how to manage their condition, many of them don't need to take anything. But have them in the cupboard just in case they have a flare, So I don't take antihistamines every day because I've got MCAS, as it turns out. Okay. And mine came out, 3 years ago as a result of the COVID injection. So prior to that, I had it, but it was so minor, it didn't really bother me. And then it was absolutely awful within an hour of having the second AstraZeneca injection. But anyway, I've got rid of it out of my body now, which is great. So you have to remove all triggers, including the spike protein. So people who have had COVID and the injections need to remove the spike protein from their bodies. And the best way to do that is with something called augmented NAC. And we can put a link for them. And this will denature.
Is that a supplement?
It's a supplement, but you have to have augmented NAC. And there's only one manufacturer of that because it's made in a very special way that actually denatures 99.8% of the spike protein and removes it from the body. So, and nothing else will work like that. And there are various podcasts of me describing why, and that's important. I don't know if you've ever seen Dr. John Campbell. His interviews. So I did one with him a few weeks ago and very clearly stated why people need to do this. But so I just put that out there because that's another trigger. So we clear all the triggers for people. They learn how to manage their condition, and then they find that their mast cells calm down and they become less reactive. But as I say, they have their little sort of go-to antihistamines if they have a flare. So for example, if I know I'm going to eat out and I will therefore not be able to control my diet so easily, or we're going to dinner at friends or something, I take an antihistamine before I go. I take some diamine oxidase as well before the meal. And then I might take an antihistamine before I go to bed.
I mean, there are going to be so many questions off the back of this. I know it. And I hope I can have you back one day because it is just, I think it's going to apply to so many people who are now thinking, gosh, is this me? And where do I go from here? But you've answered a great many questions. Thank you. Is there anything you think that you normally advise patients that we've missed in this conversation?
I think for everybody, especially patients with this, but everyone, it's important to do things like grounding, to go outside every morning. So when I wake up in the morning, after my visit to the bathroom, I go outside barefooted onto the grass and I look at the brightest part of the sky. So I'm setting my circadian rhythm by looking at the sun early, and you try and do it in the first hour of sunrise. So this morning I was out there at I think it was 5 to 5. Because I generally wake up naturally with the light. But you want your bare feet on the grass because that's going to be replenishing the microcurrent that you need, the electrons that we need. We need 3 million a day, and the earth will give them to you, and it puts us back into balance. And then go out at lunchtime as well, not necessarily barefooted then. You can touch a tree, that would do it. You can touch the ground with your hands, that would do it. And again, it's very important to do it when the sun is going down and to go out and look at the setting sun, because that will set your circadian rhythm so that you'll get a much better sleep pattern going. You can also have grounding sheets and on the bed, and we sleep with a grounding sheet, because what better than to be grounded all night long? If you're sleeping for 8 hours, you might as well be benefiting from being grounded the whole time. And there are clinical studies that show that it reduces inflammation in the body and people sleep better, the quality and quantity of sleep is better. So this is really, really good.
Well, I have wondered about grounding. Looking at this area, it comes up a lot, and I've pushed it to the back of my mind. I thought, well, I'm sure that's absolute hogwash.
Do it, Claire, do it. Okay. Do it, honestly. And then things like getting outside, very important. Vitamin D, making sure you've got good levels of vitamin D, over 125 units in your blood. We follow orthomolecular medicine. The principles in orthomolecular medicine are: make sure that somebody's nutrition is right. So that means eating organic, fresh food, no processed, no leftovers. That's important, especially for the histamine people and the MCAS patients, but certainly for everybody really. So no processed. Let's get away from all the toxins in the processed foods. Let's eat nice, fresh, organic if at all possible. I eat omnivore, but you want to be eating some meat. And some patients go completely carnivore, and it really reduces their inflammation within days. So that is something for people to think about.
Yeah.
So good food, clean water. That means in glass bottles from a well or in a spring, or in through filtered. It has to be filtered to get all the toxins out of it. Plenty of water. We want to be supporting the body. So in the orthomolecular medicine, it's good nutrition, making sure there are no deficiencies. Good idea to have your hair analysed every 6 months. That'll give you a lot of clues about whether you're deficient in something, and then you can correct it. Diet, toxicity, getting rid of toxins. So whether that's doing something like Toxaprevent, a zeolite occasionally to clear out any aluminium, heavy metals, etc. that are in your system, and getting rid of the spike protein, that's a toxin. Sorting out inflammation, whether that's chronic or acute, which is the general advice for the MCAS patients. Maybe that's antihistamines, maybe that's natural antihistamines, like making sure you have a good dose of vitamin C every day, quercetin, etc. Making sure your hormones are all in balance. So that's looking at your TSH. TSH should be less than 1.5 MIU per litre. Unfortunately, the lab seems to think it's okay even if it's up to 5.5. So the GPs will read it off as normal and say it's normal, which is what happened to Jessie. And actually, the endocrinologists out there will often say it needs to be below 1.5 for it to be optimal.
And what does TSH stand for?
Thyroid stimulating hormone.
Okay.
So that's your thyroid function, right? So very, very important to have. And the thyroid is like making sure that all of your metabolism is at the right rate and everything is happening at the right rate. So if that's out, then people are sluggish, they have low energy, they put on weight, their gut is sluggish, they can get constipated, they get dry skin, nothing works very well. So so less than 1.5 it should be. And then, so that's hormones, hormones, diet, inflammation, to get rid of toxins. And the last thing is stem cells. Stimulate your stem cells, and that will make you younger.
How do we stimulate our stem cells?
Oh, that's a whole other discussion.
Right. We'll get you back if we possibly can to tell us how to stimulate our stem cells, and that'll be the ultimate cliffhanger.
Yeah, absolutely.
Tina, I so appreciate it. Thank you for your time. I'm so glad to hear that your daughter's well and that you're doing well as well, and I would love to have you back sometime.
Thank you very much, Claire. I'd be delighted to come.
An hour with Dr. Pearce was definitely not enough. We just scratched the surface there, and I know a lot of you will have more questions about the information and opinions she shared. There are some good resources out there though which should help provide answers, so I will link to additional information in the description, including a link to the Zero Spike research project that identified NAC as having potential, as Dr. Pearce discussed, for helping eliminate what's been termed as the toxic spike protein. It's her opinion that augmented NAC could benefit people who had the COVID vaccines or long COVID, but other physicians may take a different view. So it's important to do your own research and also talk to your doctor if you're experiencing symptoms of long COVID or histamine intolerance. I will link to more interviews with fascinating experts like Dr. Pearce in the description below, and you'll also find a link where you can sign up to my free monthly newsletter, rounding up all my latest content so you don't miss a thing. But for now, thank you so much for being here today.